Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Etomidate. Etomidate is most cardiovascular stable agent. Etomidate is an intravenous agent of choice. It is used in cardiac patients and in vascular surgery. Etomidate is respiratory stable. Side effects of etomidate include adrenal suppression. Etomidate can result in nausea and vomiting. This nausea and vomiting is maximum in intravenous agents. Etomidate can cause a side effect, that is, on injection of etomidate can be painful. Etomidate can result in convulsions, though rarely it can cause convulsions. Etomidate is intravenous agent of choice in cardiac patients and vascular patients. It is respiratory stable. It can cause adrenal suppression, has side effects. It can cause nausea and vomiting, and it is painful infection. Convulsions are rare. It is also causes. It is always given under cortisol and vitamin C coverage, and it increases the risk of nausea and vomiting, and also myoclonus.
thank you and thank you for watching.